So today we'll be starting about the general physiology, and among general physiology we'll be starting about the body fluid compartments. Okay. So why do we require this thing? Because stability in the volume and composition of the body fluid in body fluid compartments is essential for the homeostasis. Can anyone volunteer what is homeostasis? Yes? Maintenance of the? Okay, very good. Thank you. So homeostasis, which will be dealing with the next lecture, but for today, homeostasis is the maintaining of the internal environment of the body. Okay. So to stabilize the homeostasis or to stabilize the internal environment, our body fluid compartments and the composition of the body fluids has to be maintained very strictly. Functions of cells depend on fluids present both outside and the inside of the cells. Okay. So cells are made up of what? Yes? Cell organelles. Okay. And what is the covering? Cell membrane, right? Okay. And cell wall is present in case of? Okay. So we have cell membrane, and inside the cell membrane there is cytoplasm. Okay. Cytoplasm is made up of? Very good. So basically it is water. So polysaccharide and all those things will come later, but basically it is water. Okay. So if the cytoplasm is made up of water, so most of our cells are made up of water, or majority of the portion of the cells are made up of water. So major part of our body is made up of water only. So basically our total body weight depends on the, or total body weight is basically huge portion of it is basically water. This is the bottom line. Okay, so therefore maintenance of fluid volume of the body is an important aspect of the patient management. Appropriate fluid replacement in dehydration and removal of fluid in edema are mainstay of treatment in fluid volume disorder. Okay, have you faced this disorder called dehydration? Yes. All of you have faced, or any of you haven't faced this thing? When you feel ki there is dehydration? As a doctor, how to identify if there is dehydration present in some patient? Yes or no? How to identify the dehydration? And what is the cause of dehydration? Yes? Reduced water intake will cause dehydration, but more commonly dehydration is caused by diarrhea and vomiting. Okay, so there will be water loss or fluid loss. Okay, so decreased water intake, of course it will cause dehydration, but normally if you have less body water or less body fluid, your body will start a thing called thirst reflex. Okay, or the body will try to have water or intake of the fluid. Okay, so basically decreased water intake doesn't cause dehydration that much. Okay, if you are in a inside of a desert and you don't have water, that is separate issue. But normal circumstances में इतना नहीं होता है. That is the extreme scenario. But in general, normally when we face dehydration, there is huge water loss or the fluid loss from the body. That is first cause diarrhea, second cause vomiting, and third cause diarrhea and vomiting both. Okay, what is the commonest cause of diarrhea? In case of children, what is the commonest cause of diarrhea? Suppose infant below 5 years of age. In India, what is the commonest cause of diarrhea in case of children? Who are more vulnerable to diarrhea causing dehydration? Adult or children or elderly? Who are more vulnerable? Children. Why? Because they can't say ki they are thirsty or they are having loss of fluid. They can't say. So you have to assess that thing. So in case of adult like us, so suppose we are having dehydration, we can go and drink water. Okay, or we will try to tell other people that I am having water loss or I am having fluid loss. But in case of children, they can't say like that. So in case of children, the dehydration is more fatal or more vulnerable for them for the disability, disease and death. Okay, so in case of children, you have to always look for the signs of the dehydration. Okay, so what is the commonest cause of diarrhea in case of children in India? Yes, stand up and say. Stand up and say. Yes, contaminated by what? Contaminated by what? Of course, there will be food source is the only source, majorly. But what is the bacteria? What is the name of the virus? What is the name of the fungus? What is the name of the thing? Anything else? What is the commonest cause of diarrhea in case of children around 5 years of age? Sit down. That is rotavirus. Okay, rotavirus. Okay, and have you faced diarrhea and taken antibiotic? Have anyone has faced diarrhea in your life and have taken antibiotic? Yes or no? No. So you have taken what? ORS only. Associated with ORS, antibiotic have taken? Anyone? Anyone? Okay. Majorly, many people take antibiotics also, but antibiotics usually acts against bacteria, not against the virus. Okay. So if a child is suffering from diarrhea associated with rotavirus, so virus के against में antibiotic काम नहीं करेगा. Okay. So in them, if you give antibiotic, that will be wrong treatment. So only treatment will be ORS and maintaining of the body fluid with the ORS. Okay. What is edema? Swelling or the swelling because of any swelling will be edema? No. Swelling because of accumulation of fluid. Accumulation of fluid. So how to look for edema in a patient? Suppose a patient has come to you. How you will be identifying that he or she is having edema? Yes or no? Yes. Palpate. Where? Which place? Where you will be looking for the swelling? Where to search for the swelling? Suppose you have lost a pen or a book. So you know where to search. You might go to kitchen, but you won't be finding the book usually. Okay? So book, if you want to search, you have to search in your bookshelf. Okay? If you want to search your pen, you have to search where you keep your pens, right? So if you want to search for the edema, so where you have to go? Yes? Extremities in the limbs. Okay, not right, not really. Where you have to search for the edema? The question already has its answer. Edema means what? Edema means what? Swelling because of the accumulation of the fluid. Fluid means यहाँ पे क्या है? Water. Okay. What is the nature of water? Human body is made up of water only. So suppose this is a human body. Okay. So where is majority of fluid? यहाँ पे. ठीक है. So if this person is like this, so fluid कहाँ पे जाता है? इस तरफ. Okay. So it depends on the person what he is doing or what she is doing, and the nature of the water क्या है? It will always flow to the downwards or the dependent part. So if a patient walks to you, if a patient walks into your chamber or your hospital, so if he or she can walk, that means he is ambulatory, right? So water accumulation कहाँ पे होगा? In the legs, because that is the dependent part. So in case of a person who is walking to you, you will search for edema in his legs. अगर legs में या पैर में edema नहीं है, that means उस person को edema नहीं है और कहीं पे नहीं रहेगा usually in case of this edema. Okay. And if a person comes to you in a stretcher, and if he or she is not movable or bedridden for a long time, there will be edema will be, what will be the dependent part? That is the back. So you have to look for edema by rotating the patient to the prone position to check whether he has or she has edema in the backside of her or his or her body. Okay. So if a patient can come to you by walking, you will be checking the edema in the legs. If a patient is not movable or in supine position or in bedridden condition, you have to check edema in the back of the body. याद रहेगा? Okay. So suppose a person body weight is around 70 kg. Okay. इसमें the body composition of a normal adult male consists of 15% fat, 18% protein, 7% mineral, and 60% of water. So that means if a person is 70 kg body weight, so कितना रहेगा water? 42 kg. Okay. Water का 1 kg का volume कितना होता है? 1 liter. So in that person or in any person 70 kg of body weight, there will be around 42 kg of water or 42 liter of water. Okay. In general, as females have more fat in their body, subcutaneous fat, so they have less amount of water, or their body weight or their total body water will be little bit less than the males. Okay. And this is the scenario in case of infant, in case of children, in case of young adult, in case of adult, and in case of elderly, males and females, and how much their body percent of water present. You don't have to remember this thing. Just look at this thing in general, that in case of infants or children, the body water or the total body water with the ratio of the percentage of the body weight will be more or less same. As he or she is growing, there will be difference in the total body water. Okay. Okay. Now this is more or less self-explanatory. Yes. If you want to ask something, you have to first stand up. Yes. I can't hear you. Huh? Why? Okay. Why can't he walk? Yes. Then I have to dig into the detail. Okay. So why a person will be having edema? Normally, we don't have edema. We don't have edema. All of us, 181 plus 1, me, 182% in this lecture theatre, we don't have edema. Okay. So why a person will have edema? Yes? No? No? Why a person will be having edema? Why there will be increased water or retention of water? Yes? Less chance, yes. If I am standing here, my legs will be edemated. Edema हो जाएगा मेरे leg में? नहीं. Yes? No, not really. Yes. Malnourished, separate issue, special condition, not really important here. Yes. Yes, very good. There will be either some renal issues, renal problem, there might be some cardiac problem, and there might be some other total body system wise problem. Okay. So edema, if a person is having edema, there might be, this water retention is dependent on either that person का heart is not working properly, to circulatory system में कुछ problem हो गया है because heart is not pumping properly, so fluid distribution all over the body is not up to the mark or normal, or the renal system is failing because the kidneys are not able to excrete the amount of water which they should excrete. So that is why there is water retention. So that means, just giving you an idea, that means the person is suffering from other disease. Okay. And some water retention in legs means he or she can still walk, but he or she is suffering from a particular disease which is making him or her gradually deteriorating towards a condition, towards death. Okay. So he or she might be walking, still there is pedal edema or the edema in the legs. Okay. And next stage kya hai? Ki when he or she is not able to walk, not because only of the edema, because of some total body related issue. Okay. There are many diseases which might be making him or her not able to do or continue a normal daily life. Okay, so edema is not only dependent on any particular scenario. It is a systemic disorder which is accompanying some other disorder, majorly cardiovascular disorder or sometimes renal disorder. Okay, this is more or less self-explanatory. Who is going to volunteer? Yes, bolo. Explain this thing. Yes.
Percentage of body water.
Okay, so percentage of body weight, total body water will be 60%. Okay, 60%. And rest of the things? So 40% क्या हुआ? No. 60% में से 60% total body का water कितना है? 60% of the total body weight. Okay. So rest of the things are solid materials, non-water. ठीक है? Okay, हो गया. Next, total body water is 60%. उसमें कितना ECF कितना ICF होगा? Okay, very good. So 20% of the 60% or 20% of the total body weight will be extracellular fluid. Okay, and ICF will be 40% of the total body weight, not of the 60%, but total body weight ka 40% will be intracellular fluid and 20% will be extracellular fluid. Sit down. Okay, so if the adult male, this is 70 kg, his weight, so ECF will be 20% of the 70 kg, right? 20% of the 70 kg कितना होता है? 1/5. मैथ्स में सब लोग खराब है? Or some of you are good? Okay, so 14 liter only or 14 kg only. So kg and liter comes hand in hand here. So 14 kg or 14 liter will be the total volume of the ECF or the extracellular fluid. Okay, and ICF or the intracellular fluid will be 40% of the total body weight of the body, total body weight of the person. So if 70 kg is the total body weight, so उसका 40% कितना होता है? Around 28 kg or 28 liter. So 28 liter will be ICF or the intracellular fluid and 14 liter will be the extracellular fluid. Okay, and total body weight is 70 kg. उसमें 70 liter मत बोलना. Okay, 70 kg is the total body weight and total body water कितना है? 28 plus 14, that is 42. Okay, is there any other fluid other than extracellular fluid and intracellular fluid? No. So total जो fluid है उसका 1/3 will be ECF and 2/3 will be ICF. So that is why there is 33% of the total body water ka 33% is ECF and 67% is ICF or the intracellular fluid. Okay, is it clear? Okay, it might come in the exam. So this chart, if you want to remember, you can remember this thing. Okay, so water balance, control of the body fluid volume will be dependent or linked with the water balance of the body. So what do you mean by water balance in general? Yes?
Salt and fluid balance.
Generally includes? Okay, so balance means what? Balance means? Yes? Okay, correct proportion. Okay, so it might be positive balance, it might be negative balance. Okay, so when we'll be having positive water balance, if the intake will be more than the excretion. Okay, and when we'll be having negative water balance, reverse, when the intake will be less compared to the what is getting excreted. Okay, so what are the sources of intake of water? Yes, drinking water, drinking soft drinks, drinking milk, and drinking other things which I might not mention here, like alcohol. Okay, so drinking liquid things. Okay, and any other sources? Yes, cellular reaction. Okay, so that will come under endogenous. Yes, yes. So basically water can be coming from some liquid and from solid food particles also. Okay, okay. Drinking of water, of course, and water ingested with food. Okay, any of the food which has more water content? Watermelon. उससे भी ज़्यादा the dal served in CC canteen. Okay, so it has more water compared to the watermelon. Okay, so that is one of the, sorry, it is not actually true, थोड़ा exaggeration है, but more or less it is comparable to the watermelon. Okay, so if you are feeling sometimes if you are feeling dehydrated, so you can try CC canteen ka dal. So it will be serving the purpose more than the watermelon. Okay, and it is cheaper also compared to the watermelon. Okay, so exogenous water intake normally ranges from 2 to 10 liters per day, depends on the person. Okay, so how much water we usually drink? You are currently drinking the water. Okay, so how much water we drink usually? Okay, you can drink. I am not asking you to stop. Okay, this is water drinking class. So how much water we drink usually? It ranges from half liter to 8 liters per day. Always depends on the, varies from the person to person, and depends on the activation of the thirst centers in the brain. Okay, ingestion of water in food. Water is present in all food preparations and fruits. Okay, on an average, ingested food varies from 1 to 5 liters per day of the water. Don't have to remember all those things. And what is the endogenous water again? That is, as he said, that is the water is one of the products of metabolism. Okay, so where these metabolism things are happening? In the cell, intracellularly. So intracellularly, whatever reaction happens, what is the major byproduct of this? Water and CO2. Very good. So these two things we have to remember. CO2 के बारे में we will be discussing after some time, but अभी के लिए water will be remembering that endogenous reaction का result है water, making of the water or production of the water. Okay, water loss का क्या क्या sources है? Pretty much common and pretty much known to you. Water loss from the body occurs mainly in 4 forms: urine, feces, sweat, and as insensible loss. Okay, so we all know about the urine. What is the normal urine volume we excrete? Yes? Yes. Any volunteer? What is the normal urine excretion in our body or from our body? What is the normal amount? What is the normal urine excretion? Yes, anyone? 1 to 1.5 liter. Very good. Any other options? Any other option? 1 to 1.5 liter. Not bad, but okay. We'll be modifying that. 1 to 1.5 liter. Any other option? Okay. Please clap for him. Okay, knowingly or unknowingly, I am assuming unknowingly, he has said something which is the most important thing you have to remember throughout the year. What is that? Not 1 to 1.5 liter, but he has correctly said there is a range. Okay, so whenever you face any viva, any exam, anything written or practical examination, so if any particular thing is asked, always say in the range in case of physiology. Okay, so suppose anyone asks you what is the normal pulse rate, what is the normal blood pressure, what is the normal heart rate, all those things, people always say 72 or 120 by 80. So please don't say like that. Always say in a range. So he has rightfully done that. So 1 to 1.5 liter nahi hai, half liter hai, 0.5 liter to 3 liter is the normal urine excretion from the adult human beings. Okay, in 24 hours. Okay, in 24 hours. So in case of physiology, anything will be always in a range. Okay, feces हुआ, sweat, and what is insensible water loss? Yes, how? Okay, how there is water loss from the respiratory system? Okay, so air gets moist. So if you are in a dry place, क्या होगा? Where there is humidity is very less, what will happen? What will happen? Has anyone been to any extreme dry weather condition where humidity is very less? Not Mumbai, of course. Humidity बहुत कम हो गया तो क्या होगा? क्या होगा? Yes. More water loss? Of course, more water loss will occur. As a result of that, क्या होगा? Yes. Sweating तो होगा, but this is insensible water loss from the lungs. If there is extreme dry weather condition, क्या होगा? What will be the effect? How we take breath? From the nostrils, nose, and all those airway. So if there is extreme dry weather condition, this mucous membrane will be getting dried. Okay, and after some time there will be spontaneous bleeding. Okay, there will be spontaneous bleeding. I don't know you have faced this thing, yes or कभी जिंदगी में, but if you go to a dry place where humidity is very less, what you are usually facing, there will be dryness of your mucous membrane around the nose, nostrils, and inside the mouth also. Okay, as a result of that, when you take breath, so after cycle, after few hours, there will be dryness inside your nose and nasopharynx and all those things. So as a result of that, there might be spontaneous bleeding because of the extreme dry weather condition. Okay, urinary loss of water is a major form of water output from the body, and mostly majority of our water loss happens through the urinary loss. About 1 liter of water is excreted from the body, that is average. Actually it ranges from 0.5 liter to 3 liter in 24 hours. Kidneys plays important role in water balance by altering water excretion in urine, which primarily depends on the hormone called ADH or anti-diuretic hormone. Okay, what is the function of anti-diuretic hormone or ADH? What is the meaning of diuresis? Okay, or more loss of water, or if you get any drug. Have you heard the drug or medicine called diuretics? Diuretics. Have you heard? Okay, when it is used, hypertension and a person suffering from edema or extreme water retention in the body, then diuretics or that type of medicine is given to that patient. As a result, क्या होता है? There will be more water loss. Okay, so diuresis means excretion of the water, or more excretion of the water. So antidiuretic means retention of the water. So what is the role of ADH? What does ADH or antidiuretic hormone does? It causes concentration of the urine. So if there is more ADH, there will be less urine. If there is less ADH, there will be more urine. याद रहेगा? So ADH is inversely proportional to the amount or the volume of the urine. Okay. Water is insensible water loss also from the skin and also from the lungs and the airway also. Okay, what is positive water balance? When there is water gain is more than its loss. What will be the effect of positive water balance? Is it good for the body or bad for the body? Depends on the situation. But if there is more water, क्या होगा? There will be, name a condition when there is more water but it is not a disease. Name a condition of the human body when there is positive water balance but it is not a disease, not edema, not anything like that, but still there is more water in the body, and as a result of that there will be changes in the body. Name a condition. Name a condition, that is pregnancy. In case of pregnancy, there is water retention and it is positive water balance. But it is not a disease, of course. So, as a result of that, there will be hemodilution. What do you mean by hemodilution? Yes? Can you tell me what is hemodilution? Yes. Black t-shirt, तुम्हारे पीछे? Yes. Yes. What is hemodilution? How? Can you give example? Increase consumption नहीं, increase water retention. As a result of that, क्या होगा? Hemodilution में क्या होगा? More water in my plasma. More water in the plasma. That means what is plasma? Plasma का major component क्या है? Water. So if there is more water in the plasma, so basically there will be more plasma. Okay. More plasma. Okay. So more plasma compared to the normal range, of course, but more plasma compared to the, what is the other content of the blood? Yes. That is RBC, WBC and platelets. So what is the ratio of the cells and the plasma? Around 45, 55. So if there is more water in the body, there will be more plasma. More water in the plasma nahi, there will be more plasma. So if this ratio changes, क्या होगा? There will be, suppose cells are same, same amount of cells are there, only water retention हुआ है, so there will be more water. As a result of that, there will be more plasma. So पहले 55% plasma था and 45% cells था. Now it has become, suppose 65% or 60% plasma and 40% cells, or 65% plasma, 35% cells. So compared to the cells, plasma is more. Yes? Okay. So there will be this thing is called as hemodilution. So suppose you have checked the hemoglobin, or you are checking the RBC count, you are checking the WBC count, you will be falsely getting low result or low values. Okay. So suppose hemoglobin, suppose normal hemoglobin level कितना है? Anyone has any idea? Yes? Anyone? One person? Yes? Huh? 12 to 16 grams in 1 deciliter. Okay? Or 12 to 16 gram percent. Okay? So 12 to 16 gram percent. For understanding, we'll be assuming that suppose 14 gram. Okay, suppose in this scenario. So suppose a female has come to you with pregnancy. So 14 gram hemoglobin पहले था. Now there is more plasma, so there will be less amount of hemoglobin. Though there is no blood loss, no such abnormality like that, but because of the water retention, because of the increased amount of plasma, it will be giving a picture to you that there is less amount of hemoglobin. Okay, so this is called hemodilution. So it causes all the blood parameters to get decreased. Also, it decreases the osmolality of the plasma, decreases, of course, red cell count, and sometimes produces hyponatremia. What is the symptom of hyponatremia? Who suffers from hyponatremia usually? Who usually suffers from hyponatremia? What is hyponatremia? Less sodium in the blood. So पहले जो सोडियम था अभी भी उतना ही सोडियम है, only the water amount has increased. So as a result of that, जितना सोडियम था वो dilute हो गया है. ठीक है? So that is the scenario called as hyponatremia in this case. Now hyponatremia में who suffers most? That is the elderly people. Have you encountered any cases where suppose an elderly person suddenly started talking something abnormal, or saying something which is not related to the present scenario, like that? So hyponatremia का major symptoms क्या है? There is brain cohesion में there is problem, and suddenly people say some irrelevant things and all those things. So suppose you meet an elderly person who is talking some insensible words or suddenly behaving a little bit odd, you might diagnose the case. Apparently he or she might be suffering from hyponatremia, and you have to immediately check what is the level of sodium in that person. If it is less, you have to inject normal saline or hypertonic saline to correct the hyponatremia. Okay, so hyponatremia is an important issue, important disorder which you have to immediately correct. Okay, what is negative water balance? When the water loss is more than its gain, simple, leads to dehydration. So if there is hemodilution, in case of positive water balance, there will be hemoglobin concentration will be more, or there will be hemo concentration in case of negative water balance. Simple. Okay, next we come to the body fluid compartments like extracellular fluid compartments, intracellular compartments, and plasma, interstitial fluid, all those things. Okay, so intracellular fluid हम लोग कितना बताए थे? Around 28 liter, right? Okay, rest of the things are extracellular fluid. Blood क्या है? What is blood? Blood is extracellular fluid or intracellular fluid? Extracellular fluid. Agreed? All of you? Think before you answer. What is blood again? Extracellular fluid. What is plasma? What is plasma? ECF or extracellular fluid. Plasma is always a part of the ECF or extracellular fluid. Now think again. Blood is extracellular fluid or intracellular fluid? Okay, I am asking, so this is a wrong answer, of course. So blood is made up of plasma and cells. Cells के अंदर क्या है? Intracellular fluid. So blood, we can't say that blood is extracellular or intracellular. It is the mixture or combination of both, because blood also contains cells. Cells के inside में there is intracellular fluid only. Cytoplasm means water only. Okay, so blood is made up of intracellular fluid as well as extracellular fluid. But whenever you will be asked this question in the exam, so in general, plasma means extracellular fluid. So we always assume that blood means plasma, plasma means blood. But it is not true. Plasma is different, blood is different. So when we are talking about extracellular fluid or plasma, plasma will be part of the extracellular fluid. But blood is not part of the extracellular fluid. It is a combination of both intracellular fluid because of the presence of the cells, and also the extracellular fluid because of the presence of the plasma. Clear? Okay. So among these, yes? With respect to body. Okay. So extracellular fluid volume कितना था और weight कितना था? Around 14 liter or 14 kg. Among them, plasma is only 3 liter and interstitial fluid will be around 11 liter. What is interstitial fluid? Fluid between the cells. So it contains around 11 liters of the interstitial fluid, and rest of the things are plasma. Okay, so plasma is 3 liter. What is the amount of blood in the body? Average 5 liter. So 5 liter में से around 60%, that is 3 liter, is plasma, and 40% are cells. Okay. Again, this is another table, self-explanatory, showing the distribution of the extracellular fluid in a 70 kg adult male. Percentage of the extracellular fluid, around 25% is plasma, around 75% is interstitial fluid. See, 3 liter and 11 liter, 3 into 4, 12. So it is around 25% and 75%, and the volume is around 3.5 liter and 10.5 liter. Okay. Now, why I am stressing on this point of extracellular fluid and the intracellular fluid? Because of the changes in the level of the or the amount of the ions. And ions may, which we have to remember, that is sodium. Sodium is present mainly or majorly in the extracellular fluid, that is around 145. In case of intracellular fluid, it is very less, around 12. So what we have to remember, that sodium is majorly present in extracellular fluid. So blood may, which one will be more? Sodium ब्लड के अंदर ज्यादा रहेगा या सेल के अंदर ज्यादा रहेगा? ब्लड में. So if you take sample of the blood, there will be more sodium in the blood. Okay, what about the potassium? Potassium will be majorly it is an intracellular fluid. So inside of the cell there will be more potassium. Outside of the cell there will be less potassium. So extracellular fluid or plasma or blood, if we check, there will be less amount of potassium always. Why potassium is more important than sodium? Because the potassium, normal level of the potassium in the blood is around 3.5 to 5, and it has to be maintained very strictly, because the potassium, if there is increase in the potassium and decrease in the potassium, both can cause the patient to die. Okay, so if you forget everything in the ward or in case of your patient, don't forget to check the potassium regularly if he or she has some disorder which might change the level of the potassium, because potassium, strictly monitoring of the potassium is most important among all these ions. Okay, next, calcium, magnesium, you don't have to remember. Chloride will be more present in case of extracellular fluid compared to the intracellular fluid, and bicarbonate also. But from this chart you have to remember three things: sodium, potassium and the chloride. Okay, last topic, how we can measure the amount of the total body water or total extracellular fluid or intracellular fluid. How to measure this thing? ये जो मैं बोल रहा हूँ कि 14 लीटर है या 3 लीटर है या 11 लीटर है, how I am going to measure this thing? What is the process? Suppose something is not present in the blood, some amount or some particular substance. Okay, so if I inject that particular thing in the blood, it will be only present if I inject previously nahi tha. Okay, so we take a substance, something, suppose substance A or B or C, whatever. So we inject it in the blood, and after some time we take the concentration of that particular substance in the blood, or blood means plasma. Okay, so if we check the concentration now, we can have an idea ki how much is the volume of the blood, because concentration, how to calculate? Bolo, maths mein kaun achhe hai? Suppose I inject 10 grams of substance A in the blood. Okay, plasma volume kitna hai? Roughly, I don't know, because I have to check the plasma volume. Okay, so next, after 1 hour, I take the concentration of the substance from the plasma. Okay, suppose it is, कितना हम लोग ने इंजेक्ट किए थे? 10 ग्राम. Okay, suppose उसका concentration है 0.1 gram per liter. Now tell me, what is the volume of plasma? Yes. So total I have injected 10 gram. Now concentration कितना है? 0.1 gram per liter. So what is the total volume? This is arbitrary. Don't compare it with normal body. Yes, कितना? 10 divided by 0.1 liter. ठीक है? कितना होता है? 100 liter. So that is the total volume of plasma. Obviously this is arbitrary. Just बोलने के लिए मैं बोल रहा हूँ. Okay. Now, is there anything else you have to think about? You have to think, or you have to be cautious about? So this 100 liter is plasma or extracellular fluid or intracellular fluid or total body water. How do I know? It is the volume of what particular substance? How do I know? Suppose this is what? Water, right? Okay. So if I inject or if I mix 10 gram of salt, normal salt, in this bottle, okay? Now, if the concentration is 0.1 gram per liter, okay, after some time, so what is the volume of the water inside this bottle? It will be 100 liter, right? Any doubt? No. But in case of human body, there are different barriers, right? There will be cell membrane, there will be inside the cell, outside the cell, there will be interstitial fluid, there will be extracellular fluid, there will be intracellular fluid. So, I have to think about some substance and what is the distribution of that particular substance. If I take substance A, if it is readily distributed all over the body, so this 100 liter will be volume of total body water. Okay, because the substance has infiltrated inside the cell, so that is intracellular fluid. It has been present in the plasma, that is extracellular fluid. It is also present in the interstitial fluid also. So all over the body, if the substance get readily distributed, that means the volume becomes total body water. Suppose this particular substance doesn't cross the blood, so it remains inside the blood. So blood means plasma here. So if it is inside the plasma only, the volume 100 liter is the volume of plasma. Okay, suppose this particular substance doesn't infiltrate inside the cells, but outside the cell it is readily distributed. So this volume will be extracellular fluid. That means plasma plus interstitial fluid, right? So by that scenario, we can detect whether what is I am actually measuring. If it is total body water or extracellular fluid or plasma, something like that. We can't measure intracellular fluid by this way, so we have to depend on the total body water we have to measure, and we have to measure the extracellular fluid. By subtracting total extracellular fluid from the total body water, we will be getting intracellular fluid. Plain and simple. Okay.